Hello, welcome to 5 Minute Videos. This is Dr. Pepe, and today we are reviewing the National Counseling Exam. And we are under the Domain 2 Intake Assessment and Diagnosis, and we are in subcategory J, assessing the presenting problem and level of distress. So in a previous video, we talked about the different levels of care. The different levels of care are going to be based on the presenting problem and the levels of stress that the client is exhibiting. Now, let's talk first about the presenting problem. So, the presenting problem is usually the initial symptoms that have caused a person to seek professional help. So usually this could be drug overdose, drug abuse. This could be self harm, self mutilation. It can be a number of things. Um, Now, it's important to understand that with mental health care, there is a fluctuation. There are ups and downs that people within, the normal range experience, but the presenting problem is the concern that the client is bringing that really motivated them to seek help. So whenever you think about the presenting problem, is what pushed the client to seek help, where as before maybe they had that problem, but they didn't seek help. So that's kind of the key factor, and usually you'll learn about it in the intake process, but it's always important to ask when you're doing the intake in order to gain more information, as well as look at the presenting problem from a holistic standpoint, because it's important to look at a multi-dimensional um, aspect. So whenever you are assessing, keep in mind that you want to look at it from the holistic perspective, looking at things like environment, genetics, culture, religion, spirituality, all gender spectrum, looking at all those factors. Usually, when you learn about the factors, then you learn about potential impacts such as stress, trauma, um, past experiences, the coping skills or lack thereof, the genetics, the family history, medical condition, substance use or abuse, also a lack of social support or social connections, and also environmental factors. Those are things that are often ignored, but certainly should not be. So, those are just some of the things that one should consider when you are assessing what is the presenting problem, and also the level of stress that the client is exhibiting. And then from that level of stress, then you will then, based on the resources, then you will determine the level of care. Then you will come up with things like treatment plans, goals. You will talk about or think about the modalities that are used, if appropriate. If the client exhibits that they are not stable, then you may talk about looking at psychotropic medication to supplement the counseling process, because if the client is in a place that you can tell they're not stable, then the first goal would be the stability in order for the counseling to be effective. So those are just some things to consider whenever you are assessing for the presenting problems and the level of distress of a client that is coming to you for counseling.